This is my asthma action plan, which I would encourage all health professionals that are looking after people with asthma that they actually give these to their patients. It will encourage patients to become more proactive and more empowered about managing their asthma. So on the front of it here, we just have a general page just with the patient's name on it, the next of kin and their emergency numbers. And just on the bottom of it is the 4 symptoms for asthma. So again, it'll kind of help patients actually recognise their symptoms. So when we turn it over, we have the green zone here, which is patients are going to be given information here about what their symptoms are and how they can to know when their asthma symptoms are controlled. You also can document their peak flow readings in there because whenever they're 80% to 100%, so what their regular peak flow should be. And down here then we have the controller medication. You just document again what colour the medication is, which is really important that patients recognise their inhalers by colour. And also then the reliever medication is on the bottom there. The next part then is the orange zone. So this is when patients' asthma starts to deteriorate. So again, there's information here given on the top about how to recognise deterioration of their asthma. So whenever they've increase in symptoms, again, what they're going to do with their medication in terms of controller medication, are they going to increase it again? That's to be something you will decide with the patient. And then the reliever medication again, whether they need to increase their use of that. If you decide to give patients some oral steroids to take whenever they're in this zone, you can actually write in there the dosages and how often they need to take them and for how long they need to take them. And then so for some information then to know that they need to contact the surgery or go to hospital if they're not feeling any better. So then we move over to the red zone, which is when things are really deteriorating and the patient is actually having an acute asthma attack. So again, it gives some symptoms there on the top as to what they might be. And they don't even have to have all of those symptoms. Even if they have one of them, they should actually seek help fairly quickly. So they either ring GP surgeries or they go to the ED department. Again, there is an emergency number there for everybody to ring if they have that, but it is important to impress that when they're in this zone, they need to go to hospital or they need to go to the GP surgery. So on the bottom part of the red zone page is the 5-step rule for managing acute asthma. So again, we need to educate patients as to how to manage their asthma whenever they're having an acute exacerbation. So there it is on the plan for them. Here on the back then we actually have a page that just we can document what the patient's regular medication is, including any oral medications they might be on as well. And we can write down in the bottom here what the trigger factors are, so that again to just make sure that patients are aware of what their trigger factors might be. And then finally then on the last page then we have some information here as to how these action plans can actually work for patients, in that it's important maybe that they might take a photo of their asthma action plan, have it on the phone, so that when they go to the GP surgery or to the emergency department, the action plan is there that they can show the healthcare professional. Also, it's really important that they share this plan with family members and caregivers. And finally, it is important that these action plans are actually reviewed by a healthcare professional at every opportunity, that whenever you meet somebody with asthma, that these plans are reviewed and updated accordingly.